Now, Professor, the issue of dental health is important in nutrition, particularly when one looks at carbohydrates, and dental health is also a marker of other diseases as well. And in considering guidelines for a nation, what would be your view with regard to dental health and whether it should be considered and whether it should be an important consideration in detailing the guidelines for a nation?
Indeed, that many people feel that the dental health of a nation also predicts their general health. And what we've observed is that as soon as the industrial diet was taken up by people living on their conventional foods that they had eaten for centuries, the first thing that changed was their dental health. And I presented some of that evidence from the Western Price data, and it's in the Western Price book, which we've discovered one chapter from that book. And when I was researching this book, I came across this remarkable article, which was published in 1932. Now, this is a definitive study, an intervention trial on how you prevent or reverse dental caries. And no one ever refers to it. And the question is, why not? And because, again, the findings are inconvenient, because they link cereals to dental decay. And so many of us are raised to believe that sugar is the cause of dental decay. In fact, in this study, it's not. It was that they were able to isolate that it was the cereals. And that as soon as they reduced cereals from the diet, the children's teeth got much better. But they did more than that. The diet was rich in vitamin D. And where does vitamin D found? It's in fat. It's in foods that contain fat. When you have a low-fat diet, it's low in vitamin D. So when we changed our diet for our children and we increased the low-fat content and we increased the cereal content, we had to destroy their teeth or make their teeth worse. So let's look at the specific evidence that he presented. Now, what I've done is I've taken the main table and reproduced it as a graph, and it takes a bit of explanation. As I recall, there were 8 groups. There were 8 studied groups, and they followed these children for a period of time, eating 8 different diets. But I've looked at the 3 diets that were the most relevant to us. So remember, this is now an intervention trial, which we believe is good science, because you intervene and you see what the outcome is. And so this is the best diet, the cereal-free diet that is rich in vitamin D. And this is the diet is worst because it have increased cereals and no added fat-soluble vitamins, particularly vitamin D. And this group is in between. They've got some added vitamins, but they're still eating oatmeal. Now, this is the group. This is how many in this particular group fed this for a period of time, developed new dental caries. And in the group that's eating the best diet, 0.37 was the number of teeth per child showing initiation or spread of dental caries. So that would be a low rate. Whereas this group, eating lots of cereals and no vitamin D, i.e. eating the lovely fat-free diet full of cereals, and you'll notice that they had 5.8 teeth in their mouth that showed deterioration. And in between, the group is in between, and that's perhaps what you'd expect. On the bottom is the reverse. So the bottom left figure where it says 4.7, that is the number of children in whom cavities showed hardening. In other words, the cavities that were already present started to harden and improve. So that's a good sign. More teeth are hardening up and the caries are disappearing. Whereas in the group eating lots of cereals and eating very little vitamin D, that's a very low content. So few of these people improved their teeth. So when you look at these two, it's very, very clear that this intervention, giving children a cereal-free diet, rich in vitamin D, was very effective in firstly preventing new caries, dental caries or cavities, and in reversing the dental caries that were already apparent. Whereas the reverse, that a diet full of cereals and low in vitamin D is going to cause that problem. And if you recall back to Karen Zinn's analysis of the so-called healthy modern diet, balanced healthy diet, that she gave to one of her professors, you'll recall that the healthy balanced diet was vitamin D deficient, whereas the high-fat, so-called high-fat diet was provided surplus vitamin D. So one of the effects of taking our children and making them eat lots of cereals and grains has to be that we've made their teeth worse. So here's the summary, and I apologize, this is obviously wrong. Group of children averaging 5.1 years of age, it should be, were given a cereal-free diet rich in vitamin D and calcium for a period of 6 months. The teeth of the children were defective in structure, and much active dental caries was present at the beginning of the investigation. Initiation and spread of caries was almost eliminated by these diets, and the results were better than those of the previous investigation in which the vitamin D alone was increased in a diet containing bread and other cereals. So in this study, removing the cereals improved the outcome even more. Active caries was arrested on the cereal-free diet to a greater extent than in the previous investigations when cereals were extensively used. This too is one of the articles that we have discovered. And Dr. Ash, this is his views on how you should prevent dental caries. Remove sugar from the diet, and I think everyone understands that. Remove phytic acid from the diet by avoiding grains, beans, unless they've been sprouted or been properly soaked before consumption, and remove soy. Eat raw dairy. Unfortunately, we can't do that legally, but that's what we should be eating. We should be eating raw dairy because there's no question that is much healthier for us if we can control the bacterial content. And nutrient-rich foods. Emphasize foods that are rich in fat-soluble vitamins and minerals. No processed foods, packaged foods, or fast foods. So that's, if you want good dental health, that's the advice that we're given. And again, that fits with the advice the information that I give to people. Avoid grains if you want to have healthy children with healthy teeth. And again, we come back to Weston Price because he was the first person to actually go out and measure and quantify the number of dental caries that were in these populations. And these are the pictures of the populations that he looked at who had not yet been exposed to the new industrial diet. And their incidence of caries was about 0.5%. In other words, less than 1% of these teeth had caries in them. But as soon as the new diet came along, then the dental caries rate shot up. And it's, again, something we don't talk about. And we have discovered a chapter of Weston Price's book in the discovery. And this is just to say that this book also includes information which is precisely the same. It's the same advice. And then finally, from that book, which I've also discovered the chapter, there's one figure which is really interesting because it looks at the diet that Weston Price analyzed in the populations that he looked at. So when Weston Price traveled around the world in the 1930s, he did analyze the diet of the people who had healthy teeth. And this is the figure that I could find. The only problem with this figure, next slide, is that there are no units. So I'm not exactly sure what the units are. But this was what he concluded. This was what Weston Price concluded in the 1930s. And in that chapter that I gave you, there's a long explanation of the difference in the diets of the indigenous diet of all these populations and what he called the modern displacing diet. That's the industrial diet. And he said that the difference in the diet was mainly in fat-soluble vitamins D, E, A, and K. And so this would mean that there's more in the indigenous diet, but whether this 1,000 times or 10 times, I can't know because unfortunately the figure doesn't have it. And then this is the diet of the modern displacing diet, and this is the mineral content. And Weston Price was convinced that this was the key reason why these people had healthy teeth, and in fact why they were so healthy. And he felt that the nutrient-dense diet, indigenous diet, provided key nutrients that have gone out the diet in the so-called modern displacing diet. And there's been a lot of questions, what exactly was it that went out? And one of the things that went out is vitamin D, as we've documented. And one of the consequences of vitamin D deficiency is dental caries, but there are many others as well. So to claim that the indigenous diet, which is of real foods, is nutritionally deficient, completely has no substance, in fact. It's easy to say, but where's the evidence? And I've shown you here, and this is not fantastic evidence, but I did give you the other evidence from Karen Zinn, and she would definitely have given us that evidence had she been able to be present as a witness. And she showed that the so-called healthy balanced diet is nutrient deficient compared to the so-called low carbohydrate, high fat diet.